morning is a gal that's been on the show a couple times, Melissa Shanley. And you are the supervisor of the Respiratory Therapy Department at ACMC, am I correct?
You are correct.
It's been a while since you've been on.
Yeah, I think last time we spoke about COPD in adults.
Okay. Okay. Well, today we're going to talk about asthma.
Yep, we're going to change it up a little bit.
And, you know, asthma is quite common. I don't know if it's just because of this area. My son had asthma, but he seemed to outgrow it.
Yeah, and that does happen. We do see a lot of asthma in children. You know, as we advance in the medical field, I think that we're able to diagnose asthma earlier. But yeah, in this area, it is very prevalent. We have kids come in that have asthma for all different reasons. They may have allergies, they may have exercise-induced asthma, and they can grow out of it. The important thing to remember is that once you're diagnosed with asthma, you will be an asthmatic for life. However, as your lungs grow and as you develop, sometimes you won't have the symptoms of asthma anymore.
So he basically still has it then?
He still has it. He's still an asthmatic, yeah. And he may, you know, as he ages, he may become sensitive again. And
well, I noticed a little bit of a rasp in his breathing. So I kind of thought, he's probably still...
He could be, and it may just be the time of year, because allergies, you know, if allergies are his trigger, then it could be the environment right now.
Yeah, when he came over the other night, he had allergy problems. And I've noticed it myself. I mean, I don't know, I noticed the other night when I sat outside, they say the tree count is high, and we have trees all around, and man, I went in the house and I was like suffering.
Yeah, well, you know, in the area that we live too, everything kind of blooms all at one time. You know, we have this, you know, we're cold, and then all of a sudden everything just decides to bloom. Right. So yeah, it is, right now is a very, very difficult time for people with allergies. The thing about allergies is that allergies usually affect your head and your, you know, up in your nose, and that drainage does affect your breathing, and it can affect your voice, but asthma is a disease of the airways. So asthma happens down here. So allergies can trigger asthma, but you don't have to have, it doesn't go hand in hand. You could have allergies and not have asthma.
Neither my wife, Steve's mom, had asthma. Is it hereditary, or? You know, they don't really know what causes it.
They say that it runs in families, and sometimes you do see a pattern there. Sometimes people say, you know, oh, I grew up in a house with smokers, and so they attribute that to their asthma. But really, they haven't found, you know, a definite link or a cause. We just know that a lot of kids have sensitive airways. So that's why we've, you know, decided to do a camp this summer and educate kids about their asthma and what they can do.
And I want to talk to you about that camp. But first of all, I wanted to ask you, is there any solution to the problem?
Asthma is very manageable, okay?
It is.
So it can be extremely dangerous, but it is manageable. You just got to figure it out. Everybody's different, and everybody can have different triggers and different symptoms. So you just got to kind of figure out what makes you have a flare-up and what works best for you in managing your asthma. And that's one of the key things that we do with kids, you know, that come to the camp, is that through interactive learning, we're able to teach them how they can be just as active and play sports and go outside and play, and they don't have to worry that they're going to have a flare-up, as long as they know what to look for and they know what to do once they start to feel a little funny.
I think my son had one of those puffer things that he used to walk around with. What are his symptoms?
Well, there's three major things that happen in the body when you have an asthma flare-up. The first one is that your airways become swollen. So just like if you were to bump your head or something like that, and you get a goose egg, that actually happens inside of your airways. So if you have an airway, you know, that's large enough to get oxygen into your body, once it starts to swell and that airway starts to close, it gets a little tougher to get the air in and out. The second thing that happens is you have smooth muscles on the outside of all of your airways, and they will actually clamp. Okay, so now you've got even less space for that air to go through. The third thing that happens is your body starts to develop all this mucus because it thinks it needs to. You know, it's kind of a reaction like you have an infection and all the fluid rushes. Well, your body starts to develop mucus. So now you have smaller airways and they're full of mucus and you're wheezing and you're coughing and you can't get air. So those are the three major symptoms of asthma. You talked a little bit about the puffer. One of the things that we teach kids at asthma camp is that they need to carry their, we call it a relief medication or an emergency medication with them, especially if they know like they're going to be, say, going to a sleepover and people have cats or something and that's their trigger. Or if they play sports. They want to make sure that they always have that handy so that if they do have a flare-up, they have an out. Kids that have asthma also want to take something called a controller medication. And that can be a corticosteroid or a long-acting beta agonist. And what that does is it controls the flare-ups so that maybe they can not have so many puffs on their emergency inhaler. You know, it's actually to kind of stave off those flare-ups. And then if they do have a flare-up, they always have that emergency inhaler with them.
You know, a couple years ago, there was the Cleveland Browns drafted a player that had asthma, and I'm thinking, oh no.
Wow.
Here we go. The Browns did it again. But you know what? That player, and I can't remember who it was. I wanted to say it was Trent Richardson, but it might not have been. But he never seemed to have a problem.
No.
I mean, he played.
Yeah, there's tons of athletes that have asthma, and some of them have severe asthma, but they've learned, how to manage that.
Okay.
And like I said, I mean, kids with asthma, I don't know if it's, their parents or if it's teachers or who it is, but they kind of are careful with them, and I mean, you do have to keep your eye on them, but there's a stigma that they can't exercise or,
right.
They can't participate because, oh my gosh, what if they all of a sudden have an asthma attack? Well, what we try to promote is that you can be healthy and you can play and you can participate in sports. You just got to learn how to manage it. It's pretty easy once you get the hang of it. We have kids age 7 to 12. So 7 is a great age to start learning about the disease and what your triggers are. That's the big one that we teach kids is, if you know that you're allergic to dogs, then
so dogs
don't
and
go near dogs.
So dogs and cats are.
That can definitely be a trigger. There's many triggers. You can be allergic to animals. You can be allergic to the environment. Coughing can sometimes trigger an asthma attack. Crying can trigger an asthma.
Kidding.
Stress in adults.
I can
asthma
understand
attacks.
crying. That's kind of new to me.
Laughing.
Even laughing.
Laughing can trigger an asthma attack. Yeah. Exercise, because when you exercise, your body secretes hormones and chemicals, and your body may have a reaction to that, and it can cause an asthma attack. Smoking, perfumes, candles.
I can understand dogs and cats because even though I don't have allergy per se with dogs and cats, I have a dog and a cat, but there are times when the itchy eyes and the watering eyes, and I'm thinking, well, it might be them because they jump in bed, and that's not good.
No, well, people love their animals, so when someone's and when someone's diagnosed with asthma, and we figure out that it's their animals, they're not getting rid of their animals. We recommend it, but you can't ask people to get rid of their animals. So what we say is don't let them in your bed. Don't let them sleep with you. Keep them out of your bedroom, actually, if you can
completely.
Do that. I would, yeah, because a lot of people have trouble sleeping if they have asthma. That's when they have their coughing and their wheezing. Wash your sheets often. They have those hypoallergenic bed covers and stuff like that. Those are a really good idea, especially for kids with asthma. Don't let your kids have stuffed animals in bed with them.
Heard that too.
Yeah, those kind of things. Dust mites, they can trigger asthma attacks
Well,
as well.
actually, like you say, when you have a dog or a cat that gets in bed, they leave behind.
It's everywhere.
Everywhere.
I have a lab and she just sheds. I mean, it's like
does she sleep in your room?
Carpet. No, she does not sleep in my room. She sleeps in my son's room usually.
Really?
So yeah, but he's okay. I mean, he doesn't have the symptoms. So
Mm-hmm.
so, but if you do have symptoms, if you have allergies, I would not allow your pets to sleep in your bed with you.
Okay.
It's just, you know, you're making it harder for yourself. You know, you can
Yeah.
keep your animals, but and like if you're allergic to you know, pollen and stuff like that, you can still work in the yard and you can still be outside, but when you come in, make sure that you change your clothes before you sit down so that it doesn't get off on your, you know, your couch and stuff like that.
Probably should shower.
You should shower probably.
Yeah.
Yep, and get cleaned off.
Now, in your capacity, you're a supervisor, correct?
I'm Director of Respiratory Therapy.
You're not like an acting nurse or anything like
I am a
that.
clinician and I work at the bedside. I do.
Do you really?
Sure, yeah. Especially if I don't have enough staff, then I work at the bedside and
Yeah?
pitch in. Sure, yeah.
So like if I
love
had
to work at the bedside.
if I had to come to you, you could be possibly the nurse in charge.
Respiratory therapist,
Yeah,
yeah. I
yeah.
have 20 years in the field, so I'm pretty
Has it been
capable.
20 years? You're too young for that.
No. No, but I also do some diagnostic testing if you know, I need to fill in there. So I do see kids with asthma and I do diagnose, you know, asthma. We do a couple different kinds of tests on kids with asthma.
Yeah, what's the test concern?
Well, basically we want to check to see if they have a reaction to something. So we can check how sensitive their airways are. We can check their volumes, how much air they can get in and out of their lungs. We can also exercise them. So we have a lot of parents come in and say, oh, you know, my child, every time they exercise, they get really, really short of breath and, you know, they can't exercise. So what we'll do is we'll do some pre-testing and we'll get some lung volumes on them and then we'll put them on a treadmill and we'll run them until they react. So we actually kind of try to get them to have a bronchospasm. And then we'll bring them back to the department and we'll put them back in our little booth and check their volumes again and you know, see what the deficit is.
Yeah.
So, but there's a way that you know, kids can manage their asthma at home and check their volumes, and I want to show you that real quick.
Okay.
Do we have time for that?
Yeah.
Okay. And this is called a peak flow meter.
Number one. What about pills?
Well, there are pills for allergies and stuff. Usually when you have asthma, you're going to manage it with breathing medications. So it's going to be probably a nebulizer or an MDI, a meter dose inhaler, which is that puffer that you were talking about.
Right.
Kids that have their trigger is allergies will sometimes be on like a Singular or something like that. Also, if a child has a flare-up, a really bad flare-up, and they have to be hospitalized, sometimes they'll put them on a regimen of steroids for a little while, and that can be in a pill form, like a prednisone or something like that.
That's the thing where you take 3 at one day and then 2 and then 1. You kind of
taper it.
wean off.
Yeah, but mainly the medications that you're going to see with children with asthma are going to be that controller medication, and that's usually in the form of a puffer. Okay, and that's something that they're going to take every day, and it's important for parents and kids to realize that even if they're feeling good, they still have to take this controller every day. Okay, and then the emergency inhaler is also going to be in a puffer probably, and that, or it could be in a nebulizer, and that they can kind of take when they feel like they need it. They don't have to take it on a regular basis. It's kind of a per diem type of medication. If they're feeling like they're having a hard time, then they need to take it, and if they're not, then they can just kind of keep it with them just in case. So,
Always be prepared.
always be prepared, for
What's
sure.
this?
Okay, so well, we're talking about medication, so I just want to show you this real quick. This is called an aero chamber. Are you familiar with this?
Oh, that way. Yes. There you go.
Yeah. Are you familiar?
No.
Okay, so what an aero chamber does is it assists children in delivering medication via an MDI. All right, you said that your son took meter dose inhalers, the puffer?
Puffer, yeah.
Okay, so there's a skill to that, and you have to kind of coordinate the push with the breath, and you know, it can be a little bit difficult for kids. So when the kids come to our camp, they get one of these spacers. And what this does is you put the MDI in the end of the spacer, and you can expel the medication, and it kind of acts as a holding chamber, because when you put it right up to your lips and you may not get it timed quite right, there's a lot of fallout of that medication on your lips and on your tongue, and it may not get to where it needs to go to work effectively. So what this chamber does is it holds onto the medication so the child can just kind of breathe it in and out at their leisure.
Okay.
And they don't have to have that super coordination.
So it makes it easier.
Makes it much, much easier. And the adults use this too. We have them for adults, we have them for kids with little masks on them, so they're very, very handy. So each child that comes to camp gets an aero chamber, and they will learn how to use the aero chamber.
Okay.
The second thing I want to show you is called a peak flow meter, and each child at camp gets a peak flow meter too. When we talk about asthma management, it's very easy to relate that to like a stoplight for children, because they understand that. So red is stop and green is go. So what we do is, on a good day, when the child is breathing just fine, we will ask them to do 3 peak flow meter blows, okay? And then we'll take the number that is the highest. So you can see there's a little volume. It measures how fast and how hard they blow out. So they would take a deep breath in. You want me to demonstrate it?
Yeah.
Okay. They take a deep breath in, and they would blow into the peak flow meter. And you can see my volume's pretty good today. My lungs are nice and open. It is based on age.
Is that what the red thing is?
Yeah. It's based on age, and it's based on how big you are. But what they could do is they would set this little green thing at their volume. And then, on a day that maybe they weren't breathing so good, they could go back and blow into the peak flow meter and see where they are. So if they're like 50 to 80% of what their best volume was, they're in the yellow zone. And they have to start to be a little bit careful. Maybe
yellow is caution.
Yellow is caution. And if they're less than 50% of what their normal volume is, that's the red zone. Okay, you're having a problem. You want to contact your physician. You maybe even want to take a trip to the emergency room.
Really?
Kids don't always associate coughing or shortness of breath with being symptomatic. Okay, so they're not always going to tell their mom, if they're outside running around, I'm starting to cough, or I'm starting to feel a little funny. If mom notices something, she can pull them aside and say, let's take a blow into your peak flow meter and see where you are today. So it's a real easy way for both parents and children to kind of gauge, what kind of day they're having and what they need to do. So we use that to help kids manage their asthma. And, as well as like the symptoms, like I said, the coughing and the...
You mentioned asthma camp.
Yes.
Where's that? What's that?
Okay, so our asthma camp is located at ACMC, and it is the week of August 11th through the 15th. It's a half-day camp.
August 11th to the 15th.
Yes.
Okay.
And it's a half-day camp. Children are dropped off in the morning, and then they're picked up at...
and they have
at
to
1
be
o'clock.
asthmatic.
They have to be diagnosed with asthma. My kids ask me that all the time. Can we come to camp? I said,
How many kids do you have?
I have 4 children.
Do you really?
I do, yeah.
I'll figure it out.
So, yeah. So, what we do with the kids is like I said, it's interactive learning. We go on field trips. We take gorge hikes. We go swimming.
Really?
Yeah, we play games. We do sports.
What was your point to treat them how to live normally?
Show them that they can, be like any other child. That they can be interactive. They can go out and they can play, and they don't always have to worry that they're going to have an asthma flare.
That's great. That is fantastic.
So, and then as I said, we teach. It's 5 days. So each day we take a different topic. The first day we talk about what happens in your body when you have an asthma attack. It's real important for them to understand that. The second day we talk about medications and the different types of medications, and we have the children kind of draw, do an art project about what their ideal medication would be, and we get ice cream cones and pieces of pizza.
Where do you take them on field trips?
We go to Penitentiary Glen.
Okay.
Yep, and all of our transportation is by community care ambulance, which they do that for free every year for us, which is very, very nice of them. So we go out to Penitentiary Glen. We go to the lodge, Geneva on the Lake, one day, and we use their facilities. Yep, they're very kind, let us use their pools, and
they have nice pools.
Yeah, we can walk on the beach, and we can walk around and look for triggers. We don't touch our triggers, but we can point out triggers. That's another day that we talk about, all the different things that cause asthma and what they can do to kind of stay away from those things.
Do you have pretty good turnout for that?
Yeah. Oh, yeah. We have, one year we had like a whole soccer team.
Really?
Yeah, it was really funny. So, and then we go to the beach one day as well. So that's our last day. We have a beach party.
Is there a cost?
There is a fee. It's $30. However, we have financial aid available. So, you know, if there's a hardship or something, by all means, yeah, please don't let that be a deterrent, because we
How do they sign up, Melissa?
they can call me or they can stop by the department, and I can send a registration form, and you have to register your child.
You would call Melissa Shanley at ACMC in Ashtabula.
Do you want my number?
And maybe we better mark that down.
Okay, it's 997
Oh, 997.
6425.
Yeah, because like I always say, once you leave, and I don't write this down, I'm sure somebody's going to say, what was that number again?
Sure, yeah.
So I got her down here, 997-6425.
Yes, and they can call me directly, and I can mail out a flyer, and then we can register them that way. Or if they're at the hospital, they can always stop by the respiratory therapy department.
What are the times?
The times for camp are 8:30 until noon, but some days we go a little bit later just because of the field trips.
Being kids, do they get snacks or anything?
Oh yeah. There's tons of food. Yeah, I know. Feed them and they'll be happy. Right?
Yeah, right. Keeps a smile on their face.
Yeah, so there is snacks. Like I said, they get a bag with a T-shirt, a camp T-shirt, and we tie-dye that. And then
do you go out with them? Do you go on the trips with them?
Oh yeah. Oh, I love it.
You do? I'm sure.
It is a really fun.
Get you out of the office there for a while.
Yeah. By the end of the week, I'm completely exhausted, but it is so much fun. And there are other respiratory therapists that help with camp. So your child is in very, very good hands. We do ask that they bring their medications with them so that we can kind of talk about their medications and how they're using them, and then of course if they need it,
if they need it,
yep, then it's right there. So
interesting. Let's take this call, Melissa.
Sure.
Hi, you're on the air.
Hey Pat, this is Kim. I didn't get the fee for that.
The fee, she didn't get the fee.
Oh, the fee is $30. And that includes all the snacks for the week, the transportation. They get a bag that's full of like educational materials. They get a T-shirt, they get the aero chamber and the peak flow meter. Yeah, so that's what that fee covers. However, like I said, please don't let that be a deterrent to anyone. You know, if there is a financial hardship, we still, our goal is to educate the children about asthma and help them understand. So if it's
they'll work
not,
with you.
yeah, for sure. Yeah, and you would just let me know that, you know, when you contacted me.
All right, now where's this camp at?
The camp is located, every day drop-off is at the hospital. So it's at the education building, which is straight across from the emergency room, where you drop off for the emergency department. It's a standalone building. Yeah. And then you would pick your children up there too. But like I said, you know, we're not always stationary. We will have field trips.
Ashtabula Hospital or Conneaut?
Ashtabula.
Alrighty, I will get back to you then.
Great, sounds good.
I've got a 16-year-old that has asthma real bad.
Okay, great.
Thank you.
Thanks, Kim. All right, there you go. You
good. We are limited to 20 kids just because space only permits us to have 20.
I was wondering if you had a...
We do, yeah. So there's 20 kids, which is a nice size group. You know, we can work with that. So if you are thinking about it, please call soon because space is limited.
Call now, folks. If you're going to... Number again, 997-6425. This young lady is Melissa Shanley, and she is the director of respiratory therapy at ACMC. I learned a lot today that I was not aware of. That's your little poster?
This is our poster, yeah.
You want to hold it up?
Yeah, sure. And I can leave it here too.
Okay. Do that. There, you can zoomed in on it. So, Camp Breathe Easy is the name. So, how long have you been doing that?
I think this is our 4th or 5th year.
Really?
So yeah. Yep, I started the camp, I want to say it was 2010, I believe. So,
that would be 4 years.
Yeah, so 2000, maybe 2009. So yeah, so it's been very popular, and I've had a lot of parents call already and say, when's camp going to be? And we're also on a website, the Consortium for Children's Asthma. So if you want more information, you can look that up.
Okay, very good.
Yeah.
Yeah, I'm glad you came in, and especially this time of year with kids going out there in the summer vacation and all that sort of stuff. And as I mentioned, asthma has affected our home, and it's been reported to me that a lot of kids seem to be suffering from asthma.
They do, and like I said, I mean, we do the diagnostic testing right at the hospital. Now, sometimes, you know, there is a misconception. Sometimes children can't breathe for other reasons. So just because your children, maybe they go outside to play and they're not able to catch their breath, does not necessarily mean they have asthma and they need to have medication. Sometimes it's just that maybe they need to get outside and exercise more.
Right, get in shape.
Yeah, and that happens to all of us. So, but yeah, I mean, there's definite symptoms if your children go outside to play and they come back and they're coughing, and they say, you know, if you see a little bit of a blue tinge to their fingernails or around their lips or anything like that, that's a definite sign that they're not getting enough air. Wheezing, I don't know if your son was a wheezer.
He had a wheeze problem, yeah.
Okay. So you can that's something that you can listen for, especially at night if you hear your kids and they're wheezing or coughing when they're sleeping. That's a sign. The most common trigger for asthma is the common cold. So yeah, so if your child has a lot of colds and they get really, really bad and they last a long time, you may want to contact your physician.
Did you have, not to change the subject before I let you go, but
Sure.
Being in the respiratory business, did
Yeah.
you have a lot of problems with that flu season?
This year we didn't have too bad of a flu season.
I had heard that. Now, Erie had a bad problem.
Oh, did they?
But I had not heard Ashtabula County being that bad.
but we have in the past. You know, it just depends on the year and if they
God, I had
get
it a
that
couple
vaccine.
years ago. I couldn't get rid of
Right.
it.
Oh, really?
And I had the vaccine too.
Yeah. Sometimes they don't, you know, pinpoint what it's going to be. That's kind of a guess.
Yeah.
But yeah, we didn't see too many kids with flu this year. A lot of colds. Some severe colds.
Do you just handle children or?
No, we do
Everybody.
birth to death. So
Yeah.
we see people of all ages,
Okay.
and we diagnose people of all ages. So,
Okay.
but yeah, we work in the delivery room all the way, you know, up to caring for people in hospice care.
The only thing I got this year was a bad case of laryngitis, which was preceded with, or was it afterwards? I can't remember now. That I did get a little bit of lung congestion, but the laryngitis, of course, in this business, I'm done. You know, I couldn't work for 3 days. But that's the only thing that happened. A little sore throat, but
That's
knock
good.
on wood.
Well, it was so cold.
It was a terrible cold.
It was frigid this winter. So we, you know, I don't know if that killed a lot of
Maybe it
bugs.
killed the germs.
Yeah. So, but we didn't see too many flus. Like I said, we do get little babies sometimes that have bronchiolitis. That's like the little tiny airways, they get infected, and babies don't have much reserve. So when they get sick like that, we have to hospitalize them. And babies, when they get sick like that, they can't breathe, they can't eat, you know, and they cry and they can't catch their breath. So we
It's
had
scary.
babies. It is scary, yeah, I know. But so we had babies, a lot of babies this winter. But yeah, but not too much for.
Melissa, fantastic job this morning.
Thank you.
Good job, and hope to see you come back sooner than later.
Anytime. I love coming to talk to you.
Yeah, we always have fun.
Yeah.
And there's a million other subjects we can talk about too.
Oh, for sure.
You know, so keep in touch, okay?
Yeah, absolutely.